What changes take place in the vagina after childbirth? This is the topic of our discussion on this video today. It is very important in reproductive health to understand the process, the change, okay, the kind of happening that takes place in the vagina as a woman gives birth immediately after delivery, within the first 2 weeks, 3 weeks after delivery. Some changes are temporal. Some changes can remain for life. Some complications can really be serious, while some are mild. This video will enlighten us all. My name is Dr. David AYEM, your midwife, you are a reproductive health expert, you are a doctor. Please, if you are watching this channel for the first time, subscribe, then you like and share. Also strike the notification button. It will help you. Okay, we are back. Get a pen and a paper. Let me put some points. Tap, 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 tap. You write them down. You need explanation or further questions from them, I'll give you. The question is, what are the changes that take place in the vagina after childbirth? Childbirth is the delivery of a baby. If a woman successfully carries pregnancy till 9 months, then labor and deliver through the vagina. I am not talking about delivery through operation like cesarean section. If you are ready, you take your points. As I already said, first point is there are several but temporal changes that occur. What are some of these temporal changes? 1, stretching. You know, the vagina undergoes the overstretching to allow the head of a baby, the shoulders of a baby, the entire body of a baby to pass through it. What we need to take note of is that God is so wonderful, even in the way He builds human tissue. The kind of tissue that makes up this organ are elastic kind of tissue, like rubber that you can pull and stretch and can considerably contract, and come back to normal. This is why you will imagine such a big baby at birth. After the baby comes out, they dress the baby, and you come and meet the mother, maybe in the postnatal ward. You're wondering, how did this big size of baby pass? It passed through the vagina. The vaginal walls have folds. You know, a fold like this. Such folds, that we call them rugae, are capable of stretching. And so if those folds can be straightened, you understand there is a big hole. You only will give thanks to God. You only will give praises to God. You only will give, in fact, thank God that it is possible for man, such an organ in man, in the human being, to stretch and allow a baby that can weigh about 3 kilograms, 3.5 kilograms, even 4 kilograms, you find them passing through there. Even though some of the babies are more than 4 kilograms, we refer to them as macrosomic babies, meaning babies that are excessively large. We are not even talking about those types because they are already out of place. It is said that a normal baby at term, newborn, at the time you are giving birth to a baby, a normal newborn baby weighs between 2.5 kilograms to 3.5 kilograms. So when a woman gives birth to a baby who is within that age, within that weight, then the baby is very normal. It means that the woman was well taken care of during pregnancy, during antenatal care, because the stretching on the walls of the vagina will not be excessive. When the stretching becomes excessive, what are other temporal changes apart from stretching? You will find bruises. That is why a woman can give birth and then you have some small stripes of wounds on the wall of the vagina. Yes, because they are human tissue. With overstretching, there is some degree of tearing. And then when you find these bruises, the next thing is that you find swelling, which is an inflammatory process. Just the trauma of the process of delivery causes swelling of the tissue, including those of the vagina. Now, when it swells like that, it pains. So, another change is pain in the vagina. My dear viewers, do you now understand why a woman needs to be educated on when to resume sexual affair after birth, after childbirth? Do you now know why a man needs to be educated to know when to touch a woman after that woman has given birth? You know, before, people will only pronounce that, no, it's 6 weeks. It should be 6 weeks. And each time we ask question, when should they resume, the woman resume sex after childbirth? They will say 6 weeks. My dear viewers, the true answer, the right answer is not 6 weeks. I am telling you that by the 6th week, these 6 weeks, some women, many are not yet ready for sex because they still feel pain inside there. They still have some bruises, especially the ones that actually are tear, not just bruise, like vaginal tear, like perineal tear, even like cervical tear. Those who went through such processes had stitches to repair the process. So, you can only tolerate any sexual affair after childbirth when the woman is comfortable with the process. So from today, when you follow this lesson, please, the answer is when the woman herself is comfortable with sex. If she is not yet comfortable, even if it is 2 months, even if it is 3 months after she gave birth, please do not force her. Yet, there are people who will conveniently give birth to normal-sized baby after quality antenatal care during pregnancy. And they may just give birth to a baby weighing 2.5 kilograms, 2.8 kilograms. Such women, even 2 weeks, even a week later, if she involves even in sex, she tells you she's fine. And there's no pain, there's no swelling, there's no over this. Yes, but that's not the case in every woman. So some women have very unique and characteristic kind of happenings or changes depending on the kind of process of labor they went through. Apart from these mild changes, which also include change in color, sometimes appearance may not look as natural as it used to be when all these stretch marks, when all these bruises, when all these wounds, when perineal tears or lacerations are repaired, a lot of them may heal, leaving scars. You see, sometimes the scar can cause obstruction, it can interfere even with the woman's sexual life. What are those changes that take a bit long? That can, the effect, the change that could involve vagina. 1, sagging. If pelvic floor muscles go weak, go slack, even the vagina can collapse and prolapse. And some women will actually come with complaint that their vagina is pushing outside. You see, pregnancy and childbirth, since the cause overstretching, they can cause weakness with the pelvic muscle that can affect the vagina. You see, aging process, as you are growing old, they can cause it. Because as you are growing old as a lady, you will reach menopause. You will understand some of the effects of menopause on the tissues of the vagina. Now, the one that is a bit tough, a bit pathetic, is fistulas. Do we know what is called fistula? An abnormal linkage linking two cavities or two surfaces. Imagine a woman in the course of giving birth sustains a tear, perineum, from vagina down to anus and into the rectum. And then maybe the midwife or the nurse or the doctor, in the course of repairing, trying to stitch, does not do very well. It heals, leaving some abnormal passages between the rectum, which is supposed to be coming out through your anus. And then you now find some abnormal linkage from rectum into the vagina before reaching outside. Such abnormal linkage, linking two surfaces like that, is called fistula. This type, which is caused by childbirth process, is referred to as obstetric fistula. Some of our women suffer obstetric fistula. Two major types of obstetric fistulas are this one between rectum and vagina is called recto-vagina fistula. But you can still have one between the urinary bladder and the vagina, where a woman will be having urine drained through some extraordinary passage and instead entering inside vagina before reaching outside. It means that maybe this woman had gone through some operation or some traumatic situation that caused an abnormal linkage, which we call fistula, between bladder, urinary bladder, and the vagina. You will find that the woman always complains of wetness inside the vagina. We don't mind the electricity blackout. Such wetness, if they check very well, it may be a fistula. This can be corrected, my dear sisters. This can be corrected. Whoever has noticed that kind of thing, whether urine coming out but from inside the vagina instead of coming from the urethra, where physis, this one is even looking, this is the one that a woman can just die. You find shit, physis, instead of coming out through the anus, it is coming out through the vagina, telling you that there is some bypass, there is some abnormal linkage where shit that gathers in the rectum is forced into the vagina before draining outside. So you find a lady wearing pad always. Or she will tell you that each time she wants to remove her pant, maybe she wants to urinate, when she brings down her pant, she sees shit, physis on it, which has not come out through the anus. It has come out but through the vagina. That is a fistula. It is not a curse. It is not witchcraft. Please, we need to take this woman to the hospital. There are equally support bodies, a lot of non-governmental organizations, including even governmental organizations, that are even asking for people with such birth complications. So sometimes you find even a man begin to lock the wife in the house when a woman has suffered a complication through childbirth. Where is your conscience when you should take her for medical care? Now hear from me. They can repair it and things go well. These are some of the kind of changes that can take place. In some communities, they'll say it's witchcraft. Oh, she has done this. That's why she is suffering. Please, take this woman to the hospital and save her life. Thank you for watching. If you can write to me, the WhatsApp number is +237 694 353141. Only write message, please, or leave a voicemail. We will follow and can answer you. Bye-bye. Good night.